walk through the PowerPoint, and it was full of pictures because she wanted all of us to meet the women in these 20 communities now. So Bendettah is a natural born leader. When we started working together, it was just a bunch of women, really. It was maybe like 20 women at the time in Lunga Lunga, and she's going to explain where this is in the map. And right now, years later, she's leading, she's running the whole project. It's a movement, it's not a project. She's leading 2,000 women in Southeast Kenya and really leading a movement for sustainable development with many projects and always focusing, as she's going to explain, on the Millennium Development Goals that already passed, and when they finished, we together started working with the 17 Sustainable Development Goals, and we keep working with this until the other new ones come. So Bendettah, I would like you just to reach our wonderful audience and do the best you can with this,
you.
Okay?
Thank you.
Thank you, Bendettah.
Jambo.
Jambo.
When I say Jambo, you say Jambo. Jambo.
Jambo.
I would like to thank everyone who has come here to hear and see me and the work that I do in Kenya. Also, I would want to thank in a special way the African Studies program for supporting me to be here with you for today and to get to know what we are doing in Kenya. Welcome. As you can see now, the map, you cannot see it. I'm from Southeast Kenya, which is found within Kwale County. Our country, it has 47 counties. And I'm from Kwale County, which is south coast of our country. It is border to Tanzania. The ones who have been in Kenya, Lunga Lunga, they know where we are. So we started with three groups, three communities. Among them, it's Lunga Lunga, which is the center of the other communities. That is Godo, Perani. And then it came Mpakani, Njirani, Umoja, Masailand. Followed by Mgombezi, Kidomaya, Njuakali. And now, today, I'm working with 20 communities, whereby their names I have not written here or read for you, because they are hard for you to pronounce. Our population that I'm dealing with, it's 120,000 people, although it is hard to get to know the right number. In the year 2009, when I met Alaseli from your university, we all we saw there was a purpose of working within our communities. We had some evaluation on our communities, and we found several things that needed to be worked. One was the communities that I do work during those times, they were remote and much isolated, very arid, and having difficult roads. Two, the communities were in low life expectancy. Three, we had child marriage of girls, trafficking of girls for sex work. We had lack of anatomy for the women. We had female genital cutting, whereby it has some infections, tetanus, urinary tract infection, and HIV, and some others. We had myths and regions and cultural beliefs with dangerous consequences for health, such as ndege, whereby it is a disease that can be cured, but the community people, they believed it was an evil spirit that was coming from above to kill the child and the mother. We had lack of basic resources and public health services, that is medical, drinking water, latrines, and transportation. And to fulfill our goals, we took women as agents of social change in health, well-being, sustainable development, carriers of culture and transformers of beliefs, myths and regions, also as keepers of health, caretakers of children, family and communities. When we started our program, we had some goals. One was to collaborate with the local government to develop a program on disease protection, health promotion, and well-being in those isolated and difficult to reach communities. 2, we had to develop a model of holistic and sustainable health at low cost, especially for girls and women, that would be easily transferable to other communities. We had also objects for our program. One was to offer health services through the Nikumbuke Health Center and the Mama Toto Mobile Clinic that included disease prevention, health promotion, basic treatment of disease, referral mechanism for major illness. 2, to create a system of health literacy for a vast number of people through summer health camps. 3, develop a system of sustainable health from within through a train the trainees program, whereby in this case we train health promoters to go back to the communities and train the women. In order to work with our program, since the year 2009 through 2015, we had to work with the 8 Millennium Development Goals. We worked together with them, and we had to, based on number 3 and 6, whereby was to promote health, where was to promote gender equality and empower women, plus number 6, which is health literacy, and later we had to use our Mama Toto piki to take our nurse to reach the community for medication and for the health literacy. The year 2015, we started working with the 17 Sustainable Development Goals, whereby all of them we worked together, but we had to observe all we combined together as what we have done with the 8 Millennium Goals, that is number 5 and 3, that was gender equality plus the good health and well-being for the women. And that is why we started using Mama Toto Mobile Clinic, whereby our nurse Josephine uses the motorbike to take medicine, health literacy on wells led by a public nurse to reach our women. Then later we saw there was a purpose of us to construct a permanent center for the women and the girls. Not only to reach the women and girls, and also to keep some of the vital equipment like the motorbikes in a safe place. Years back, we kept on increasing the number of buildings, and these buildings are being used in several ways. As you can see out of the picture, we have women who come to the center. When we are having special occasions, they prepare food there. Very happy, they share many things that they are going through the community. As you can see, you see Damaris there, people who are preparing food, and also behind them we have houses where they can stay overnight, or they can stay for some days if they have any domestic violence at their homes before it is being said. We kept on working with the community, and we started a program known as mentorship program, whereby we deal with girls who are in primary level. They come to our center on Saturdays, whereby we upgrade their schoolwork, and also we keep on reaching them to get to know the importance of completing education and to be like the rest of the girls in the whole world. Also in the Nikumbuke, we have constructed a permanent health post for women and girls. As you can see there, we have our nurse Josephine, who the first time when we opened the clinic, we had a long line of women waiting to be attended by our nurse. And not only treating the women, she has other activities that she does in that permanent post. Like she does disease prevention teaching for the women, basic diagnosis, basic treatment, family planning, and health literacy. Also in our facility, we have Ndendo unit for women, and we allow men to be attended. And due to lack of clean water in our community, we have been supplying water tanks. So far, we have given out over 100 water tanks, whereby during rain season, people, they harvest water, and the water is being used during the rain season, and also when it is dry, for drinking and cooking. And there you can see the first tank was given to that lady, who was very happy to see that instead of walking some kilometers to fetch water for a girl to go in school in the right time, now they are very happy together with their daughter, who is going to attend classes in the right time. We saw that the tanks were very beneficial to the community, so we kept on donating more tanks to the women. And before they are sent to the women homesteads, they are kept in the center, whereby the women, they come and transport in different ways. Some they carry it using the motorbike, others they just push them until they are at their homestead. The year 2010, we had a grant from your university, whereby we started anti-malaria campaign. And during that time, we had some students from your university. And one among them, she's here, we have Megan. So, during that year, Megan was among the students who came from your university, and she assisted us to donate and to supply the nets to our women, and to monitor how they are being used by the women. Only later to find that the women, they were not happy with the white nets. Instead, they requested we change the color of nets, and the following year we gave blue nets. Also in our facility, we have trainings for women as health promoters. When we receive students from your university, they assist us in many ways. One is training the women to become community health workers. And we are happy that the certificate that they are given, we have several who have been employed by government of Kenya and Tanzania due to the certificate they have received from your help of your students. Also, we are very happy to receive more students from your community, from your university. As you can see there, we have a very huge utility that was brought by one of your students, and was a man that they used to teach our children. And even now, we are using the huge uterus when we are teaching, or when we are reaching the community and the girls and the women. Also, we have street health theater run by the women that we call it Avya Ukumbi, and the women, they do several dramas in different diseases like cholera, malaria, HIV, maternal health, nutrition, family planning, female genital cutting, domestic violence, myths and beliefs. And what you can see there is among the women who are performing drama on malaria, and that woman, she's acting as the mosquito. But when we started using the treated mosquito nets, the mosquito cannot bite the women. As you see down there, we have a pregnant woman who is sleeping on a treated net, and the mosquito is there trying to bite her. But as you can see behind, we have several people looking at what will happen to the mosquito, because after it bites the net, it will die. Also, in our facility, we have classes on technology and the digital world for women and girls. When also we receive students from your university, they assist us, and even men are being assisted to be given that technology. In the years when I started working with Alaseli, we were conducting meetings through Skype, and the women, they were wondering, how can you talk to somebody who is some miles and kilometers away, you see, and you talk with her. But the technology has grown. Now we are using the Zoom. Even during the pandemic, we conducted several meetings that we were able to train the trainees to go back to the community and continue supporting our women. So nowadays we have many things like also the phones that we are using to reach our women. In our community center, we have what we call vocational school for girls and women. We call it a tailoring school. Here, we reach the girls who are in risk of being trafficked by the road drivers, taxi drivers, who we are using them as sex workers. But we are now working with them, giving them the skill whereby later they can earn something to keep their lives. Also, we have business incubators in our program. We call it microfinance system, which is being run by the women, and they control it. They are able to start their business and also to boost their businesses. We started also what we call secondary and post-secondary education. We are working with the girls, whereby we are supporting them with the secondary school fee to complete their education. And we are networking with an organization from Sweden known as From One to Another, which enables our girls to be retained in school. And for example, this year, they have supported 360 girls from our community by paying a half of the school fee for them to be in the school. Also, we have what we call reforestation incentive and sustainable nutrition, whereby we have plantation of moringa trees. These trees, they are very vital in our community because it has several, the parts of the tree, it's being used in several uses. The leaves, they have a lot of vitamins. The seeds, we use them to purify our dirty water. And also the seeds, they are being used, if you chew some of the 2 to 3 seeds and you had blood pressure, it comes down. The same if you have headache. So even now, I'm missing the seeds because I'm used on chewing them every day. And you does not have the trees here. We have what we call Moringa and Maize Cooperative, which is run by the women. And this time now, we talk about gender switch. Because there before, the women were being employed by the men. But this time, our women in the community, they are the ones who are employing the men. In our center, we have what we call community library. And I think this idea came from Mansell. Because at the corner of that building, you see our small library. And you see I'm there with one of your students who was a student from your university. This one, it has a slogan which says, take one, return one. So in this case, we want our community people to keep on getting to know how to read and write. And it is there within our center. Some years back, we started what we call Female Soccer League with 2 groups. Later, the groups increased and now we are having the community teams for the women. And we have seen several people from all parts of our country coming to our community asking us for advice on how they can start their own women's soccer teams. We were lucky last year and this year to host the US Embassy from Nairobi came for the tournament. And we shared much while we were having this tournament. And that is among one of the teams, after they win, they are being awarded a sample of your university. Now, after hearing the successful stories of our program, also the successful program that we have done, and out of the 8 Millennium Development Goals that we combined with the 17 successful developments using the motorbike, we are still having challenges that are hindering us not to reach our goals. One is gender norms, that is inequality and lack of autonomy for girls and women. Still, we have women who cannot be given permission. All they have to ask is permission from their husbands to come and work with us. We have two cultural beliefs, whereby some of the people in our community, they are not accepting the origin of some of the diseases. They believe they are from origin. And some of them, they are not attending the clinics. Still, they believe that witchcraft are the best doctors for them. The lack of transportation. We have been working for several years. We have been using these motorbikes, and some of us now, we have aged. We have our bags are heading due to the motorbikes and the roads that are bumpy all the time. So that is a big challenge. When we have rains, even we cannot reach our women on the time that we have selected to be. Lack of clean water, drinking water also is still there. Although we have given out over 100 water tanks, those water tanks are being shared by several families, whereby you find the water is not enough. So we need some more water tanks to have clean drinking water for the community. Also, some of the people, they does not have latrines. They go to the bushes. And when we have rains, we have places where they collect water. And we have seen that is another way on how they spread these waterborne diseases without having the latrines. Now, as I continue, you can see some of the women that we work with. You can be familiar with them. You see Anna, Patricia, Dorcas there. They are trying to